Hello, everyone. We are back again with another new episode. And this time we have with us again Dr. Krishnaraj Ganesh Narayan. Dr. Krishnaraj is a he holds a PhD in oral biology from Rutgers University. He brings with him a rich 18 years of clinical experience to the table. A respected professor, a researcher, and a keynote speaker, he has authored national and international publications too. Dr. Raj also serves as a key opinion leader for 3 global dental companies. So, a warm welcome to Dr. Krishnaraj. How are you doing?
Thank you. Thank you, Amol. I'm doing fine. Thank you so much for the wonderful introduction. I'm always excited to come back for this episode and looking forward
Yes,
to having some good discussions.
we are back again with another new exciting topic for the benefit of our listeners and viewers. So, shall we straight away get to the question and answer session if you're ready?
Absolutely.
All right. So, starting with the first question for the day for you. Okay, first of all, I didn't introduce the people to the topic that we are going to be talking about. And this time we are going to be talking about antibiotics. A highly, it's used a lot in not just dentistry, but even other fields of medicine. But at the same time, it is a very highly misused and abused medication, I would like to say. So let's probably try to kill a few myths over here about this particular medication called antibiotics. So starting with the first question for the day. What are antibiotics and how do they fight the body? How do they help the body fight the infection?
Good question. I mean, for the listeners and for the viewers, and I'm assuming most of them are not medical people.
Right.
Antibiotics are actually chemicals that are produced by bacteria themselves. So
Right.
you see, when bacteria grow in complex communities called biofilms, they compete with each other for survival. So the bacteria within themselves try to kill the other bacteria to survive. So some of these bacteria produce some chemicals which us humans have thought, being very intelligent, trying to isolate those chemicals, and then they are called as antibiotics. And these
True.
antibiotics are nothing but ones that are produced by bacteria themselves. And we have tried to use our intelligence to try and engineer those molecules by making them semi-synthetic or something synthetic to add a few things so that it is a little bit more effective. And these
Right.
are antibiotics and they belong to different generations and they belong in the different mechanism of actions and stuff. But the idea is the antibiotics are used to kill bacteria and not kill viruses and not kill fungi. So you see any infections in the body are mainly either due to bacteria, fungi or viruses. But
Absolutely.
antibiotics are purely used to treat bacterial infections.
Right. Right. So how do they help the body in fighting the infection? Can you elaborate a little bit more on that if you can, please?
Yeah. So what happens is whenever our body gets infected, it could be, let's say, a dental infection or
Right.
any infection in the body. There is a imbalance in the number of bacteria and number of host cells. So the bacteria tend to overgrow. If a particular density of microorganisms or bacteria in an area is higher, they'll start producing toxins which kind of overwhelm the body immune reactions. So we have
Right.
our own body cells which tend to fight the infection. But if the bacteria amount is much greater for our body to handle, then it results in something we call as an infection, and this results in formation of pus, and we
Right.
call as sepsis and things like that. So antibiotics are something that is new, that are used to kill the existing bacteria. So we take these antibiotics, and when patients consume these antibiotics, the chemicals that are there, they will go to the site where the infection is present, and they will start killing the bacteria so that it will allow time for our natural body cells to fight and recover from the infection.
Right.
So that's how the antibiotics basically work.
Thank you. Okay, so coming to a dental scenario, antibiotics are given in case of infection in the tooth, like a periapical abscess or a cyst or even other scenarios. So, if the pain starts to go away after the administration of the antibiotics. Does
Yeah.
that mean that the infection has completely gone from the body, from the dental foci?
See, this is an excellent question, and I think all your viewers and listeners should listen to this very carefully because this is very important. When we start taking antibiotics, within the first couple of doses that we take, we generally prescribe, okay, take 2 times a day or 3 times a day for 5 days. Now the patient starts taking the end of first day itself, greater than 90% of the bacteria are actually killed.
Right,
So then the remaining 10% is sufficient for the body to take care. So why
right,
do we need to take the antibiotic for 5 days? A simple principle is it is the theory of natural selection. So in forests, what happens? In if you look at wildlife, the survival of the fittest is what we call, right? So the weakest kind of die and the fittest will survive. So what
right,
happens when we take antibiotics? The weaker bacteria will all die, but there will still be about 5% or 6% of the bacteria which are able to sustain themselves in presence of these antibiotics that will continue to persist. And if we
right,
stop taking that antibiotic just because we are feeling better, then those you are what we are doing is you are selecting for those resistant bacteria to survive. And once they start growing, the next time the patient gets an infection, you take this antibiotic, it will not work because your bacteria have already learned to overcome the presence of this antibiotic. Which is why there is a dosage of 3 days or 5 days to eradicate even the most resistant of those antibiotics, of
right,
those bacteria, so that in about 5 days' time, we expect entire 100% of the bacteria to be either killed by the antibiotic or taken care of by the body. So it is
right.
extremely important that you may feel better within a day, your swelling will come down, your pain will come down, and then you think that why should I continue taking the antibiotic? It is not good for the body, it is chemical, and we stop taking the second day. That's the worst thing that you can do for yourself.
Right.
So please, when a doctor gives you an antibiotic for 5 days, whether the pain is there, or whether it's not there, the swelling is there, or it subsides, ensure that the dosage is completed. This is very different than a painkiller. Now, a painkiller is something that you can always stop if there is no pain. But an antibiotic can never be stopped once you start taking it till the entire process.
Right. You always increase the risk of your body getting resistant to that particular antibiotic if it is stopped midway. That was a very, very wonderful explanation. I believe this is really going to help our listeners and viewers a lot. So basically, follow the doctor when the doctor says complete the full course, of antibiotics. Never stop it midway. Wonderful. So basically, if somebody stops taking the antibiotics midway during the middle of the course, what exactly is going to happen to the body? If you can elaborate a little bit more on that aspect in a very layman, simple, easy to understand language.
Let me put it little numerically.
Right.
Let us say your body has got 100 bacteria inside. You start taking the antibiotic, and in the first 10 days, 90 or first day, 90 of those bacteria are killed. Now, when 90 of the bacteria are killed, you are left with only 10 bacteria. Now, your body can easily look after and clear those 10 bacteria. So the question is, why do we still take the antibiotic when the remaining bacteria can be easily taken care of by the body? The point is the bacteria can continue to persist inside the body, even if it is one or two in number, for a long period of time. Why? Because bacteria don't live like a single bacteria or two bacteria. They live in complex communities. And
Colonies,
these
right.
colonies
Yes.
are called as biofilms. And so why these biofilms are there is to protect the bacteria from enemies. Now, what is the enemy of the bacteria? Is the antibiotic.
Right.
So if the antibiotic is not taken completely, that one or two bacteria which form these colonies, the entire colony tomorrow will become resistant to the bacteria, to the antibiotic when it is given the next time. So it is necessary that the entire 100 of the bacteria are completely cleared, which takes time, which is why we give it for 4 days or 5 days or 3 days, depending upon the severity of the infection, depending upon the type of antibiotic it is, the age of the patient, and the presence of any other systemic conditions. We monitor we alter the dosage and the duration of the antibiotic. But whatever it is, it needs to be completed.
Right. Wonderful. Wonderful. Okay, now if you stop these antibiotics midway, and if the person, the patient, happens to get the infection back again, will it become more difficult for us to treat it then the next time the patient has it, in case the antibiotic has been stopped midway by the patient? Do you think there's any difference between taking care of the infection the first time and the next time because of this scenario?
I'll give you a wonderful question again, Amol. I'll give you a real life example of this. Last week, I had a patient who came to me. Patient was visiting the native place. The patient had a swelling, and the local dentist has given one round of antibiotics, and the pain subsided, and the patient has waited about 10 days and then come back to Bangalore. And once the patient visited me, I had to start the treatment for that patient, and I had to restart the antibiotics again. The same antibiotic, but I had to restart it again because there were some persistent infection, signs of certain infection. Now, whether you complete the course or sometimes you don't complete the course, there are two things to consider here. One is how severe the infection is and how long the antibiotic has been taken. The endpoint of an antibiotic usage should be the eradication of infection, not symptomatically feeling better. Secondly is when a patient is being given antibiotics in the second dose again, within a short period of time, or a third dose in a short period of time, there could be additional side effects to the patient, which would include acidity, can include loose stools, it can include a lot of alterations of taste and metallic taste in the mouth. Many other antibiotic-related side effects, which can easily be avoided if the treatment is completed during the course of 20 minutes.
Right.
So please don't stop your antibiotic and then give a break and then try to take another course of antibiotic. It is only going to worsen the outcome and it is going to aggravate the side effects as well.
Right. Great. So, are antibiotics always necessary for any kind of dental treatment? If a patient walks in with a swelling or with a pain or some kind of dental infection, is antibiotics always the first thing that we need to start with, or what would your approach be in such a scenario?
I, for one, do not believe that antibiotics are always necessary for every dental infection.
True.
It is like this. When we have stomach pain, because we have eaten too much food, outside food, what we do, you stop ordering on Zomato, Swiggy for 2 days, you become normal. But if you have a when you have a dental infection, unless the etiology, which is the main cause of that infection, is treated, just taking antibiotics is not going to be sufficient. And most of the time, when we are doing the treatment for the particular pain, that itself will reduce the infection, and and antibiotics are usually not needed. So when is the choice that should we take an antibiotic or should we not take an antibiotic? I always gauge it, one, based on how severe the infection is. Like we said, if the patient has got a severe swelling, at that point of time, we can do the treatment, but if you give an additional antibiotic, it will augment the effect of our treatment. If the patient has got some systemic conditions, like if the patient is suffering from uncontrolled diabetes, or the patient has also have some other habits like smoking, which would in directly or indirectly affect the healing responses. There, I always try to give additional antibiotics. Another area where I generally recommend antibiotics is in case of reinfection. Let's say if you have done a root canal and there is a reinfection of the root canal, then in those cases also sometimes I try to give an additional antibiotic. But not all the cases. We, in fact, a lot of the surgeries that we do, periodontal flap surgeries that we do, I don't prescribe antibiotics to the patients unless there is some sort of a systemic condition. So not all, for your listeners and viewers, but not all your dental infections need antibiotics. Your dentist is the best person to decide whether antibiotic is needed for you or not, considering your age, considering the severity of infection that you are having, the other systemic considerations. But if your dentist does decide to give you the antibiotic, then please follow the entire course. Don't do heroics and try and stop your antibiotic course in between.
Right.
Follow, and there are some antibiotics, for example, which have dietary indications, right? So you cannot take some antibiotics you cannot take on an empty stomach because that will trigger acid reflux and other conditions. So make sure that some of these antibiotics that you take them after the proper food or a meal. There are also some antibiotics which will have interactions with dairy. So, for example, in our gum infections, there is a certain type of medicine called doxycycline which interacts with dairy foods. So we always,
Right.
in our Indian, yogurt and curd rice are kind of common. So we advise patients not to have dairy products 1 hour before and after consuming the antibiotics. So these are certain specific indications where it comes to dental infections that your doctor will advise you, and then please follow the instructions. If at all you have any doubts, please call up your dentist. Your dentist will be more than happy to answer any questions regarding the potency, the efficacy, the side effects, alterations, or anything that you wish to ask.
Right. Also, I would like to add a couple of points. Our body has got some immunity on its own, so probably it's worthwhile to give your body a chance to fight off the infection, at least the small infections at the beginning, before you commence your full-fledged dose of course of antibiotics is what I prefer to do before getting started. All right. Wonderful. One more time, thank you very, very much, Krishnaraj. I hope this particular episode of ours is going to help our viewers and listeners a lot. We shall be back again with you with another interesting topic. So long.
Thank you, Amol, and looking forward to very interesting topics like this in future.
Great. See you again very soon. Bye-bye.
Bye.